Thousands flock to the Valley for a very fun-filled Super Bowl weekend. No one really thinks about infectious diseases that they may bring with them and how exactly our own measles outbreak will be affecting those guests as well. But Valley health officials, they're certainly thinking about that. ABC 15's Mary Ellen Resendez live with what they're doing to keep Super Bowl fans healthy. Mary Ellen, this is really interesting. How long have they been planning this?
You know, I was really surprised, but the county's top physician says they have been putting health guards in place for more than 18 months, and it's going to include a pretty extensive surveillance team stationed right at the stadium to watch for any hosts of symptoms that could arise. Just a few flags out there.
We've got all kinds of enhanced surveillance.
The county's top doc, Dr. Bob England, and his team are always on alert for infectious diseases like the measles, which recently hit the valley. But Super Bowl crowds have them working double time, watching for illnesses that might be showing up at emergency rooms or other places.
Even hotels are reporting higher than usual numbers of people sick. We can check and see what kind of medication is flying off the shelf.
County poison control centers are also on high alert. After all, the Super Bowl means fans are intercepting a whole lot of food out there, and they want to make sure restaurants aren't causing any penalties.
The poison control center is asking everyone who calls whether they've attended any of the special venues so that they will notice right away if there's more than one, for example, with the same kind of problem who attended the same venue.
Surprisingly, the Valley's measles outbreak might be making national headlines, but
I'm not worried about the measles.
That's because county health officials are comfortable that they've been able to track down the carriers and nip the outbreak before it even came close to the stadium.
If you are going into a big crowd today, good chance you're going to bump into flu. Good chance you're going to bump into upper respiratory disease. Really, really, really remote chance that there's going to be anybody with measles anywhere in that crowd.
Now, the health surveillance system is so extensive, county health officials are even watching animals for any illnesses that would affect both pets and people. And they're pushing the same slogan as law enforcement. If you see something out there, say something.
And wash your hands all the time. I mean, I always just go in and wash it whenever I think about it, right? So really, really important. I know it sounds so silly, but it is. It can make a huge difference. Mary Ellen, thank you.